Here to discuss more about this is nurse manager of the biocontainment unit at Johns Hopkins Medicine in Baltimore, Nisa Ernst. Nisa, thanks for being here this morning. What's your reaction to this plunge in life expectancy?
Tim, when I heard that, it's so fascinating. There's so much of what impacts our life expectancy is our lifestyle choices. You look at obesity rates on the climb, smoking dropped dramatically, but yet we still have this obesity that's kicking in. There's a lot of stressors in life. I think that is fascinating that the World War II generation, is we're not we're not going to make it the way that generation did. And I'm not necessarily sure why, but I do think that's a fascinating statistic. I also think it speaks to something else. You mentioned that women live 5 years longer
Mm.
than men. That's a really good. We need as women to start looking at our financial stability early and often, because in a lot of situations, still there's, the husband may be the breadwinner and the wife has 5 years and she may not be familiar with a lot of the financial situations. And, finances also impact your health. People that are less prosperous have poorer health outcomes. We know that. Your study spoke about it. 3 years for African American men. That's stunning.
What about the element of this that doesn't even take into account the way that people have delayed treatment? Nearly
Yeah.
500,000 people in the United States have died as a result of COVID. But what that number doesn't represent is the number of people who have perhaps died because they chose, perhaps early on in the pandemic, not to seek treatment for something that was bothering them. They also, perhaps the rise in mental health crisis that we've seen as well, and the effects that has had. What are you seeing and what are you hearing from your nurses at the biocontainment unit at Johns Hopkins?
Well, throughout the whole hospital, Tim, you really hit on it. We're seeing now patients that are in the hospital are sicker than they were before COVID, because you're right, they have delayed treatment. And you're talking, in endoscopy, you're talking about missing a colon cancer screening and then ending up with stage 4 cancer. That is very much a reality. If I can encourage anyone is to make those appointments. The hospitals have done a really good job of keeping COVID at bay in their non-COVID units. So really get the care for your family members. Don't hesitate. But you also speak to the mental health, this isolation, right? The fact that people are just saying, why even bother? Add on to that this winter storm that we're having across the country. The impact on that is very significant. We really need to take care of each other, and we really need to look at ways in our lifestyle and in our choices that we can support better health outcomes for a diverse population.
We are getting quite a bit of good news when it does come to COVID here in the United States and around the world. Here in the US, numbers that we're seeing in terms of hospitalizations and new cases are at the lowest that they've been in months. What are you seeing at the hospital right now?
Tim, we're seeing the same thing. Our golden number here is 8,000 cases in the state of Maryland. Yesterday, we were at 6,053. That's significant because when you and I were talking a few weeks ago, we were in the 7,500s. And one of the things that's keeping people out of the hospital are these new monoclonal antibodies and these treatments that people can get in an infusion center for mild COVID symptoms, which stops them having to be admitted.
I think there are a lot of questions about who the vaccine is right
Mm.
for right now. One of the questions that keeps coming up in my circle among friends who are pregnant is whether or not the vaccine is safe for them. One friend who's pregnant is choosing not to get it right now. Her doctor has told her that her doctor has not told her to get it. Other friends who have been pregnant and have already had kids did get the vaccine early on. What's the latest research showing, and what does it say about the way that we do clinical trials here in the US?
Well, the research is still pretty consistent. I think the pregnancy question is really up to the individual couple about what they're going to do with that. I'm seeing a lot more of my friends, anecdotally, who are pregnant saying, I'm going to make that choice. I'm going to make the vaccine. One of the common threads among all of these vaccines is because we have no immunity to this virus, anything is better than the complete non immunity that we have. I think that, again, Tim, I can say, and I've read these studies and I've talked to patients about this and I've talked to family members, we're talking big studies here We're talking, 17,000 people in one study, again, across a diverse group. That's pretty solid science. And then you hear these stories like, there's a small group, I think it was the South African variant. There was 10 people that they looked at and then they decided, to stop using that vaccine. I really want to be cautious about that because in any numerical situation, you're going to have different percentages. And so what's that 10 people from? Is that 10 people from 10,000 people or is it 10 people from 100 people? That makes a difference. I really encourage people to really get some good information about the vaccines because, again, one of the things that is helping us, Tim, is the fact that we are getting healthcare workers vaccinated. So that chance of us not being at the front line is diminishing.
We are seeing, despite the vaccine rollout has improved, we are seeing some very disconcerting statistics emerge in terms of data of who is and who is not getting vaccinated. Nisa, Bloomberg in its vaccine tracker yesterday started including demographic information, including the shares of populations of Black, white, Asian, and Hispanic people who are getting vaccinated. And we're seeing really disconcerting numbers among numbers of particularly Black and Hispanic people in terms of the share of vaccine that they are getting compared to whites and Asian Americans. What can be done to increase awareness of the vaccine and accessibility of the vaccine to make sure that everybody is getting vaccinated in an equitable way?
I think the accessibility is one piece we should talk about. There isn't enough supply right now. I've signed up to do a lot of vaccine clinics and they cancel all the time because they're saying we just don't have the vaccine to vaccinate people with. So as that supply increases, you're going to see much more vaccine available. I think you're right on. Right now is the time to reach out to all the different diverse communities and say, what are your concerns about this vaccine? What can I help you with? I actually talked to a Latinx group on Sunday, and one of the things that they pointed out to me was that it was difficult for some of their members to get this vaccine because culturally where they came from, the government wasn't always trustworthy. So that's a very different take than it is for another group who may have another cultural experience that we need to work with. A lot of some of our work among African American populations, in terms of studies, has quite frankly not been fair. With Tuskegee, we can talk about a lot of those things. But let's identify that and let's get this information out to people and let's give people the opportunity to ask questions.
Nurse manager of the biocontainment unit at Johns Hopkins Medicine in Baltimore, Nisa Ernst. Nisa, thanks so much for taking the time this morning. We appreciate it. We should note that the Johns Hopkins Bloomberg School of Public Health is supported by Michael R. Bloomberg, founder of Bloomberg LP and Bloomberg Philanthropies.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.